I think public policymakers, entities like Medicare and CMS, I think play an important role. Just as I mentioned, they played an important role in value-based payment. I think they'll play an important role here. I think the most recent information that they've released suggests that they have a clear intention to do that with respect to equity, which I think is appropriate. I think is good. And you and I don't have to look very far to identify examples in which the quote private sector or other groups have followed the lead of CMS, right? And state Medicaid programs. So I think that's critical. We can unpack that. But I think in policy setting, and when it comes to payment, in how do you design the incentives and the payment programs, incredibly important. We need that. I think provider organizations, I think there are two different directions, and I'm not saying anything new. I think there are examples of people doing it. But one is to say within more traditional healthcare delivery, the quality of healthcare, the extent to which delivering care to people affects their health, right? Because we know with social determinants and everything else, there are other things, right, outside of the healthcare sphere. But within that piece, what are we doing to drive equity? Then there's a few things they can do related to kind of measurement, programming, et cetera. We can get into that. But the other kind of segment there is how are they going outside of healthcare to partner with communities, other groups, community-based organizations, et cetera, to begin to edge away from healthcare purely and to say healthcare touches up against and is adjacent to many other things. And so how can we create new programs to do that? Housing, food security, et cetera, et cetera. So I think for those stakeholders, it's incredibly important to update what they're doing in their traditional business and then edge into adjacent spaces to address equity. I think outside of that, I think public policymakers have a critical role.